Sandy Chin here, urologist and 0530 ever provener, here to talk to you about urinary incontinence or involuntary loss of urinary control, otherwise known as pissing your pants. Very common condition, just as Dave Whitney. 1 out of 4 American women will have an issue with urinary incontinence at some point in their lifetime. There are 2 main types of urinary incontinence. There's stress urinary incontinence, and then there's urge urinary incontinence. And the importance is, it's important because the treatments are very different. So stress urinary incontinence is wetting because there's an increase in intra-abdominal pressure. So the bladder, think of the bladder as a muscular water balloon. When it's full and you apply external pressure on it, if the pelvic support or the muscles are weak, if the sphincter is weak, that external pressure will then transmit to the bladder and you'll leak urine. So what causes an increase in intra-abdominal pressure? Sneezing, coughing, laughing, and almost everything we do at the gym. Running, jumping rope, box jumps, lifting, squatting. So the risk factors for developing stress urinary incontinence are having had children, getting older, if you have a chronic cough or are chronically constipated. Anything that weakens the pelvic floor support is going to make you at risk for developing stress urinary incontinence. The treatments vary between physical therapy, Kegel exercises you've heard about. Just like going to the gym, if you do your Kegels only once, it's not going to be effective. You've got to be regular about doing them on a daily basis to notice any impact. And really, stress urinary incontinence beyond that is a surgical treatment. Urge urinary incontinence is, gotta go to the bathroom all the time. You know where every bathroom is. If you don't get to the bathroom in time, you'll start wetting yourself. The treatments that can help with this can be, there's a broader range of treatments. So there is still pelvic floor therapy. There's behavioral modification. So something like managing your fluid intake, when you drink, how often you urinate, that can be helpful. To medications, to Botox. We can inject Botox in the bladder. It's not just for a pretty face. To a type of acupuncture that we can do, to more invasive surgical therapies. So stress urinary incontinence, urge urinary incontinence, very common conditions in women. You're not alone. Don't suffer in silence about with this. Come see me, come talk to me. I'm in the gym very frequently. Hit me up with questions. Happy to help you out.